thank you so very, very much for taking time out of your day to learn a little bit more about Pennie, about who we are and what we do. We are literally, as a state agency, we are 1 month and 1 year old. Okay, so if you haven't heard of us, that's okay. There are a lot of people who haven't. Our name, just to start with our name, where did Pennie come from? Well, it's Penn, that's Pennsylvania, I, which is insurance, E, which is exchange. And what we are is we are quite literally the official replacement here in Pennsylvania for healthcare.gov. Okay. And we got our start in a way that was pretty revolutionary when you think about it. Prior to Pennie's legislation, what gave birth to us, the Commonwealth of Pennsylvania on an annual basis was paying back about $98 million a year to healthcare.gov just for the use of its platform. Okay. There were a very forward-thinking group of policymakers and legislators in Harrisburg that got together and said, you know what, we can do this better. And we actually created 2 programs for the price of 1. We created a competitive state-based marketplace that ultimately benefits our customers. We then used a big chunk of that 98 million that would have normally gone back to healthcare.gov. We utilized a big chunk of that to set up a reinsurance program here in Pennsylvania for health insurance in the individual health insurance market. And what that does is it acts a lot like, well, the thermostat in your home. It helps regulate the monthly premiums and rates that people pay here in Pennsylvania. Now, why is that important? Well, it's important because you can have the best health insurance for sale on the planet, but if people cannot afford it, you have got a boat on dry land. Okay. Now, that's also another important thing to mention. Number one, what is Pennie? Pennie is the official replacement for healthcare.gov. What are we not? We are not an insurance company. We're the marketplace. We are the platform on which all of the best insurers here in Pennsylvania bring their best in health insurance products. Well, and dental. We sell dental insurance too. They bring their best products to us. Now, we have 3 different metal tiers. We have gold, silver, and bronze. All 3 of those metal tiers have to adhere at a bare minimum to the 10 minimum health essential benefits that are set forth by the Affordable Care Act. Now, what are they? Well, just to name a few, things like maternity, newborn care, mental health services, substance abuse services, emergency services, urgent care services, outpatient services, and the list goes on. Well, prescription services too, prescription drug services. Pennie Insurance is good insurance. We don't sell junk insurance, and we don't permit the sale of junk insurance through Pennie.com. We also are in a position where individuals who have a pre-existing condition can come to Pennie without fear of being rejected because of that pre-existing condition. You can shop, you can secure coverage, and a most common example of that is through 2020 and 2021, there were a lot of our friends and neighbors who lost their jobs. Their lives literally were turned upside down. And for many of them, Pennie was a saving grace because we were here to provide them with that protection that they needed, even though they might have had pre-existing conditions. And here's another cool thing about Pennie. Pennie provides protection to individuals who are under the age of 26 who need to remain on their parents' insurance. Okay, so I mention all this to say that back on July 2nd of 2019, Governor Wolf signed into law Pennie. We launched officially on November 1st of 2020. And we did so with unanimous bipartisan support in both chambers of the Pennsylvania General Assembly. Pennie's good for everybody. And through our inaugural year of service to the Commonwealth, we've done a lot to help move the needle in terms of getting people insured and protected. We are the only home for accessible and affordable health insurance in the Commonwealth of Pennsylvania. I get asked this question a lot, and the question is, okay, well, what's the difference between going to Pennie for insurance or going directly to Capital Blue Cross or to Highmark or UPMC or Geisinger or Independence Blue Cross? Well, here's the thing. Like I mentioned before, Pennie's not an insurance company. We're the marketplace. So our goal is real simple. We want to get you protected. If you go directly to a Capital Blue Cross or Geisinger or UPMC or Highmark, fantastic. But here's the thing. If you access that same insurance through Pennie, we have financial assistance available to help you pay for it. And that's generally the number one barrier for a lot of people when it comes to getting viable health insurance is they have to answer that question, can I afford it? Well, the good news is that through Pennie you can. And that's why we're excited to talk about Pennie to anybody across the Commonwealth because, well, number one, we're new, but number two, we really have a record level of financial assistance that can help people get protected. As you see here in the middle of the page in big bold letters, 1 in 20 Pennsylvanians wake up every day, go out into the world, and do so without the protection afforded by health insurance. Now, think about this. The number one reason in the United States, the number one reason that people go bankrupt is because of unmanageable medical bills. Pennie's here to help with that. We don't want to see anybody young. We don't want to see anybody who's an older Pennsylvanian in a position where they have to cripple themselves financially. We want to provide them with assistance. And that's what Pennie's here to do. Now, that brings up the question, who is Pennie here to help? Well, we are the individual health insurance market. We are not Medicaid. We are not CHIP. We are not Medicare. We do not provide group benefits. So who are we here to help? We're here to help individuals who don't qualify for Medicaid, who don't qualify for CHIP, who are too young. In fact, 36% of our customers at Pennie fall into the 55 to 64-year-old age bracket. They're individuals who did it right. They worked hard, they retired early, but they don't qualify for Medicare options yet. Well, Pennie's here to help. We're also here to help small business owners, sole proprietors, small precision manufacturers, agribusiness owners, individuals who are lawfully present, people here on student visas, worker visas. If they're on a path to citizenship and have a green card, we can help them. We're also here to help individuals who've been recently released from incarceration. We're here to help individuals who have lost their employer-sponsored coverage, who may have received a COBRA letter and are scratching their head wondering, how am I going to pay my health insurance when it's almost as much as my mortgage? The good news is Pennie's here to help with all the above. Now, we do offer at Pennie a no wrong door policy. Well, what does that mean? Well, it means that we recognize that not everybody in Pennsylvania, not everybody, period, is born with an inherent knowledge of health insurance. Nobody is. It's a confusing subject. It's a subject that a lot of times if you mention health insurance to folks, they'll get this look on their face like you gave them a glass of lemonade without the aid part. And that's justifiably so. It's a complex subject, but it doesn't have to be if you know the right people. And Pennie Pennie's here to be the people to help bring clarity to that confusion. We're also here to provide the financial assistance for people who are scratching their heads saying, how can I afford this? Well, we can help with that. We can also make sure that your health insurance isn't junk insurance. We'll make sure that it's quality insurance. Now, we've got 4 different layers of assistance, all free. All service at Pennie is free. Okay. The first layer of service that we have is through our online self-service portal, pennie.com. It's interesting because there were a lot of people that when we first launched, when I would do presentations, they would, raise up and they would growl at me over the fact that, well, why aren't you pennie.gov or pennie.pa.gov? How are people going to know to trust you? Well, guess what? We did our research, and the best thing that we could do is get the GOV out of getting people protected. That was the first and foremost thing that we could do. And it goes back to what I just shared with you a couple slides ago with regard to Pennie's legislation. We were born out of a unanimous bipartisan effort. We were born for the benefit of everybody in Pennsylvania. So why not be universal? At pennie.com, you can shop anonymously. We don't ask you to create an account. We don't force you to provide us with your contact information, your email address, your phone number, your social security number. No. What we do is empower you to make your own decisions. Now, again, we know sometimes you need help. So we have a customer service center, 844-844-8040. The one nice thing about our customer service representatives at Pennie is they don't work for insurance companies. They work for the Commonwealth of Pennsylvania. They work for you. They are there to provide you with unbiased, no hassle, no pressure, education about whether or not you qualify for financial assistance, what plans are available in your market. They'll help you comparison shop those plans, and then ultimately put you in a position where you as a consumer can make a very well-educated choice about what's best for you and your quality of life. But we recognize the fact that not everybody likes to work online. Not everybody likes to work over the phone. So in communities across Pennsylvania, we have thousands of Pennie certified brokers. These are licensed professionals who can literally make a professional recommendation on your behalf as a customer, no matter how complex, no matter how critical your needs are from a healthcare perspective. They are the individuals who can best get you to a point where you feel not only protected, but you know that you've got the right insurance for your everyday needs. Second to that, we have our Pennie certified assisters who are a lot like, and we have hundreds of them across the Commonwealth of Pennsylvania. They work for hospitals, health centers, faith-based organizations, community centers, but they're people in the community who, like our customer service representatives, provide you with unbiased, no hassle education about what is best for you. And ultimately, they'll help you. They'll guide you to making the decision that's best and right for you. Now, I mention all the support because, well, this is where the rubber hits the road. Boy, this heat map represents 607,000 of our friends and neighbors who wake up every day in Pennsylvania, go out into the world without health insurance. If 2020 and 2021 have taught us anything, it is that people need to be protected. There's no good excuse for not being protected. Again, we get the fact, the number one objection, I can't afford it. Well, guess what? Come on down. As you're going to see here in a second, we've got some help for you. But when you take a look at this, the darker the blue, the more, I guess you could say, the higher the population of uninsured. So when you look at places like Adams County, Franklin, Cumberland, York, Perry County, Dauphin County, Lancaster, that's an area of chief concern for us. What I don't want you to lose sight of is that in a place like Adams County or York or Franklin, the population's different. The community makeup is different. Just because you see a lower number of uninsured doesn't mean that it's not problematic, that it's not something that we, as Pennsylvanians, should try to take aggressive action towards helping people get protected. Now, here's the good news. The good news is, number one, Pennie has an open enrollment period. It started on November 1st, and it will end on January 15th of 2022. And there's really good news about the financial assistance. With regard to financial assistance, we have at our access right now the American Rescue Plan. Through 2021 and 2022, and yes, I get this question a lot, what about 2023? Well, guess what? The legislators and policymakers are already working on a solution for 2023 and beyond. But for the here and now, we have an unprecedented level of financial assistance available to all Pennsylvanians who need coverage in the individual health insurance market. Number one, if you were an individual making $51,000 a year, or a family of four making $105,000 a year prior to the American Rescue Plan, you would have received no financial assistance, none. Now, under the American Rescue Plan, we can cap premiums at no more than 8.5% of the household income over that 400% of the federal poverty level mark. So how does that really matter? Well, I've got some good scenarios to share with you. This and all of the scenarios you're about to see are, number one, they're good insurance. It's not junk insurance. It's actually based upon Pennie's benchmark plan, which is our second lowest cost silver plan. Good insurance. Generally affordable premiums, affordable deductibles, co-insurances, and co-payments. Okay. Here's an individual who makes $19,000 a year. Prior to the American Rescue Plan, he would have paid about $66 a month for his health insurance. Again, our second lowest cost silver plan. Now, under the American Rescue Plan, we can offer individuals like this access to very, very good quality health insurance for $0 premiums each month. Now, this saves people like this about $792 a year, almost $800 a year. And if you make $19,000 a year, saving an additional $800, that's very, very helpful. But you heard me mention before that about 36% of Pennie's current customers fall into the 55 to 64-year-old category. Here's an example of a couple. They're 64 years old. They retired 1 year early. They do not qualify for Medicare options yet. They make $77,500 a year as a fixed income. Prior to the American Rescue Plan, and no, this is not a typo, they would have paid to cover two people $2,462 a month. If you think, wow, that's a lot of money, you're absolutely right. Wow, that is an incredible amount of money. But there are a lot of Pennsylvanians who find themselves in a position where this at one point was their reality. Now, under the American Rescue Plan, you remember I mentioned that we cap the premiums every month at 8.5% of the income? Well, now this couple, to cover two people, pays $550 a month. They save nearly $23,000 a year. Now, if you are an individual or a couple heading into what should be your most carefree time of life, saving $23,000 a year, that not only could that purchase you a vehicle if you wanted it, but it could send you on a good cruise if you wanted to take one. So in that case, there are a lot of individuals who are benefiting from the enhanced financial assistance. We also have an example here of a family of four, okay? This family of four makes $52,000 a year. Prior to the American Rescue Plan, this family of four would have paid about $285 a month. To cover four people, that's not bad. But under the American Rescue Plan, for the same level of insurance, the same quality of insurance, this family of four pays a little over $20 a month per person, $87 a month total, to cover four people. And with that, they save $2,300 a year. That can really help. So I mention all of this to you to reinforce one thing. The impact of the American Rescue Plan has been significant in being able to help Pennie protect a lot of Pennsylvanians. As part of our local control here in the Commonwealth of Pennsylvania, Pennie actually launched during 2021. We launched from February 15th to August 15th of 2021, our COVID-19 enrollment period. This gave us the ability to literally insure an additional 65,000 individuals here in the Commonwealth of Pennsylvania. Granted, we still have 607,000 uninsured, but we're working on it little by little. What's nice about where we're at right now is that nearly 50% of our customers pay less than $1 a month for their insurance. Nearly 68% of our customers pay less than $50 a month for their health insurance. So from that perspective, we've still got a lot of work in front of us, but that's why we're excited to share information with you about our open enrollment period. We have a huge deadline that's looming. That deadline is December 15th, which is next week. If somebody you know wants coverage for January 1 of 2022, it is incredibly important that they contact and reach out to Pennie by December 15th for January 1, 2022 coverage. Now, we also recognize the fact that not everybody is, especially during the holidays, is going to be thinking about health insurance. But that's why from December 16th to January 15th, the end of our open enrollment period, we provide that additional 1 month window where if you missed out on the January 1 deadline on December 12th, you can actually apply by January 15th to secure coverage by February 1st of 2022. A lot of people, they believe that Pennie may go away once open enrollment closes. That is the farthest thing from the truth. What we do is January 16th to December 31st, we literally open up special enrollment periods, these 60-day windows that people who have qualifying life events can come to Pennie and they can shop for insurance. And there are a lot of qualifying life events that would open up a special enrollment period for someone like you. A couple things just off the top of my head. You could have a birth in the family, a death in the family. You could get married, you could get divorced. You could move from, and I'm using this as an example, you could move from Erie, Pennsylvania to Gettysburg. You could lose your employer-sponsored coverage. You could gain lawfully present status here in the U.S. You could also be in a position where, you may have, been recently released from incarceration. Those are all types of qualifying life events that open up that special enrollment period for you. So please keep us in mind throughout the course of the year. And again, I want to remind everybody that we understand it, Pennie. We understand that navigating health insurance can be a chore. It can be something that can be intimidating, but it doesn't have to be. Our goal is to provide clarity where people were confused. And we also want to, provide that financial support that people need to get to the heart of the matter, which is, can I afford good insurance? Through Pennie, you can. You can reach out to our customer service line. Again, they're unbiased professionals that are eager to help you get to a good place. 844-844-8040. During open enrollment, we're open Monday through Friday, 8 a.m. to 7 p.m. and on Saturdays, 8 a.m. to 1 p.m. Also, we have thousands of Pennie certified brokers and hundreds of assisters across the Commonwealth of Pennsylvania that if you want to meet with somebody in person, I think you'll find that there'll be individuals who aren't very far at all from where you live that will be there to provide you with the professional guidance that you need. Again, our customer service number is 844-844-8040.